Dr. Curtis, what do you tell your patients about options for treatment and management for stroke?
Well, if someone starts to develop a stroke, they need to get emergency help as quickly as possible. The first thing we normally do is an imaging study of some kind, like a CAT scan or an MRI, to be sure that it wasn't bleeding in the brain that caused the stroke. If it's not that, if it looks like it was either a blood clot or a blockage, then the usual treatment is to very quickly try to open up the blockage. And so sometimes a stent will be put in, and a stent is like a little scaffolding that'll open up a blockage and restore blood flow to an area, or otherwise treat a clot and try to get rid of it. So once those immediate things are done, that's the best thing we can do urgently to treat a stroke. Sometimes if patients have blockages in the artery that goes to the brain, it's called the carotid artery, and there are blockages in there, they may require some sort of surgical treatment to open that up. And then longer term, we use drugs like aspirin or aspirin-like drugs to prevent further buildup of these blockages in the arteries to prevent future strokes.
So it appears that the prevention is very important thing to consider with the use of antiplatelet agents.
Right, so anytime we use aspirin or a drug like that in a patient who's at risk for a stroke that's specifically not related to atrial fibrillation, we do use them and they're important.